And Essence Magazine is celebrating its 55th anniversary, and this weekend it will be hosting the biggest party. Essence Fest will take over New Orleans. This year's lineup includes Maxwell, the Isley Brothers, Boys to Men, and a star-studded tribute to Quincy Jones.
Essence Fest is not just about entertainment. Black leaders in business will also gather to discuss economic empowerment and healthcare access. And here to tell us more all about it is President and CEO of the Global Black Economic Forum, Alfonso David, and Dr. Aletha Maybank, the former Chief Equity Officer of the American Medical Association. Good morning to you both. Thank you for being here.
Good morning. Thank you.
Good morning. Thank you for having us.
Good. Now, Alfonso, we'll start with you. The Global Black Economic Forum has been partnering with Essence Fest now for several years, but this year is going to be a little bit different. How will that be so?
Well, thank you. First, again, thank you for having us. The Global Black Economic Forum is a global enterprise that focuses on economic opportunity for marginalized communities. And we do that in a number of different ways. We focus on the future of work, the future of wealth, the future of health, and the future of democracy. And this year, what we're doing is centering most of our programming on the future of health. Why is that? Well, if you're not healthy, you can't really generate wealth. In some cases, you can't work. In some cases, you can't engage civically. And so what we want to do is make sure that we're centering this message for business leaders, for entrepreneurs, but also for members of the public. How do we reestablish our relationship with our health? How do we reclaim our health, especially in this moment when so much is changing, right? Healthcare is being compromised, as we know. There's conversations in Washington about potentially making significant cuts to Medicaid and Medicare. And so we want folks to really reestablish your relationship with your health. And we're going to center that at our business summit, at our public convention, in most of our activities, so that business leaders as well as members of the public understand how important it is.
Yeah, I mean, that's really important information to share, especially when there's so much health disparity. You used to work, Dr. Maybank, for the New York City Health Department.
Yes.
What can you tell us about the health disparities that are out there?
Well, what we know is that they still exist, right? So disparities being differences in health outcomes between communities based on identities or based on location in the city. You know, we know within New York City, we have community districts that do great. You live longer lives, and we have other community districts that have been underinvested and they don't live as long. And so what we know, the opportunity in terms of the partnership with the Global Black Economic Forum, is that we not only have business leaders, but we have the general public being able to come together to talk about and plan about what does good health mean? What does it mean to come together, to have health be with us, for us, and by us for our communities? Because if we don't do that, especially in this particular time where we know there are absolute gaps in communication, we're going to lose a lot more people than we have. And so it's really critical that we're able to come together across the ecosystem, not just with health leaders, but as Alfonso has just said, with the democratic leaders, with the workforce leaders, with all of those leaders to really plan for the future of our health.
So we have health topping the agenda, but what other outcomes are you hoping to see at this weekend's gathering, Alfonso?
So we are inviting more than 250 business leaders from around the world, world leaders, academics, philanthropists, venture capitalists, to come in and really dissect some of the complex issues that are affecting marginalized communities and come up with solutions. So that's one. Second, we are expecting more than 500,000 people. It is the largest festival in the country.
That's amazing.
500,000 people will come through the convention center over the course of the weekend. And one of our goals is to make sure we're providing them with information so that they can affect their behavior, their conduct, and hopefully take action. Really, at this moment, we're talking about mobilization. We're talking about how do we take active steps to make sure we're informing our future, future of our work, future of our wealth, future of our health. How do we take active steps in doing that?
Yeah.
And so we're hoping that we can implement those changes this weekend.
But as individuals then, how can we be a part of the solution?
Exactly. And for some people, if they can't make it down to New Orleans, all of the content is going to be streamed live.
Wonderful.
So we're making sure that we are not only speaking to people on the ground, but we're taking this content and making sure it's accessible.
And I think the other important piece of that is that as we are convening there, is that people are able to take it back to their own communities and think about how are we planning. So we're kind of bringing people to plan together, but then how do they go back to their individual spaces is what's absolutely critical. The local context is absolutely critical to advancing health at this point in time in our country.
Yeah.
500,000 people. That's going to perhaps double the population, Thinking about that too, bringing the message home. People think Essence Fest, older people, but I imagine too, you want to engage with younger people as well.
Yes. Well, the demographics is quite wide.
Yeah.
So we have 70% of the folks that attend are women, 30% are men, and it ranges between 18 and 64. Folks that come to Essence Festival. Again, the largest festival in the country. So yes, engaging with young people about what does your future look like and what is your role in it. That's really what we're focused on. And at this point where so many people feel a sense of apathy and disengagement about whether it be the political process or something else, we want to make sure we're providing them with useful tools to engage with their futures. And we are optimistic. We've been doing this for a few years. We're optimistic that we're going to see a lot of engagement. Yes, there will be concerts over the weekend, but we're going to be providing information during the daytime to make sure we're mobilizing people and educating them for active engagement.
And that's the beauty of culture, right? Culture is where people are at. And I think, I've been in the health community my entire career, and I think we are very well-intended people, but we're clear that sometimes, we're in our own lane of how we focus, how we do things. But we need to kind of get better at how do we connect with people in the cultural places of where we know they're going to be. And 500,000 people, there's no entity that really does that. So that speaks to me that at this time, we as health leaders need to be in that space to figure out how do we better connect those dots, especially again during this time when our typical communication vehicles are not the same.
Yeah, well, Dr. Maybank, Alonso, thanks so much for coming in and sharing the important information from your event.
Yeah.
It's going to be a party.
Yes, big party.